Okay, this is my recording for removing and inserting a urinary catheter. My name is Sarah Kurtz. So I would start off by coming in, doing hand hygiene, introducing myself to the patient, saying, "Hi, I'm Sarah and I'll be your student nurse today." I would go ahead and verify their name, date of birth, and any allergies that they've had. And then I would go ahead and review my order and making sure that I have the correct tubing. And then I would go ahead and provide privacy by pulling the curtain. And then I would go and explain to the patient that today we're going to be inserting a urinary catheter into you so we can monitor your urinary output. And then I would go ahead and move them in, go ahead and gather my supplies. So I would need a sterile urinary catheter kit, and then I would need something to clean the prenatal area with. So then I would go ahead and raise my bed. I would go ahead and don gloves, but I don't have gloves, so we're going to pretend like I have gloves today. And then I would go ahead and move the patient into the needed position. So if this was female, I would have them move into a dorsal recumbent position, having their knees bent. And then I would, if this was male, I would have them lay in a supine position with their thighs slightly abducted. Then I would go ahead and assess the prenatal area to see if it needed to be clean. And of course it doesn't need to be clean because this is a stuffed animal. So then I would go ahead and then I would remove my gloves to perform hand hygiene. Then I would move to my sterile kit. I would go ahead and take off the bag that it came in, but I've already done that. Then I would go ahead and open it away from me first. And pull it back. And then I would go ahead and grab my other draping. Making sure to stay to my 1-inch border. And then I would see to which side was the shiny side. And then I would lay the shiny side down, making sure to keep that sterile. And then I would go ahead and throw the other draping away because it's not needed. I would also have donned sterile gloves, but of course I've already opened up this kit so I don't have gloves, so we're going to pretend. So then after I had my gloves on, I would be able to move and touch all of the sterileness because I have sterile gloves on. Then I would go ahead and set up all of my stuff. So I would go ahead and open my swabs to clean, and I would lay those here. And throw that one away, and then I would also open my lubrication and put that into a well so I would have that necessary. Then I would go ahead and grab my syringe, take off the cap, and then I would grab out my catheter. I'm going to lay my tray back down. I'm going to put the tip of it into lubrication, and then I'm going to also attach the syringe to the needed place, and then I would leave that down. Then I would go ahead and move over to my patient. I I would go ahead and open up, this is a female, so I'm going to open up the labia, and I'm going to grab one of my swabs, and I'm just going to start away from me and go from top to bottom and throw this one away. Then I'm going to grab my second one, do the side closest to me, go from top to bottom, throw that one away, and then I'm going to grab the last one and go from top to bottom in the middle and throw that one away. Then without lifting this hand, I'm going to go ahead and grab my catheter, making sure it has enough lubrication on there. I'm going to grab it, making sure it doesn't touch any of the sterile, anything not sterile. I'm going to move this out of the way. Bring it over here, closer to my patient. I'm going to ask them to bear down, and then I'm going to slowly insert it into my patient. Once I saw urine coming through the catheter, I would insert another 1 to 2 inches, and then with holding the catheter with my non-dominant hand, I would grab my syringe and insert 5 milliliters of the water, and then I would go ahead, after I got that inserted in, I would tug on the catheter, making sure that it didn't move, knowing that it's inflated. Then I would go ahead and remove my syringe. I would go ahead and use a lock to attach this to the patient's leg. Then I would go ahead and dispose of all of my supplies. I would go ahead and remove my gloves, do hand hygiene, lower the bed, provide them with a call light, and then I would document my procedure. Now I'm going to move on to removing the catheter. So I would come in, do hand hygiene, introduce myself saying, "Hi, I'm Sarah, I'm going to be your student nurse today." I would go ahead and verify the patient's name, date of birth, and any allergies that they had. Then I would review the order, making sure that we were removing a urinary catheter today. Then I would go over to the patient and explain that today we're going to be removing your urinary catheter. And then I would go ahead and raise the bed. I would go ahead and put on gloves. And then I would go ahead and grab my absorbent pad and put it underneath them. And I would also, I would put the pad underneath them. And then I would go ahead and get my syringe. And I would go ahead and reattach it. And then let the water drain out of the balloon by gravity. Then I would go ahead and grab the catheter and then slowly pulling it out, making sure to coil it. Then I would wrap it up within the absorbent pad and dispose of it as needed. And then I would go ahead and clean the prenatal area, and then I would go ahead and dispose of all of my supplies. I would go ahead and remove my gloves and do hand hygiene. I would lower my bed, provide the call light to the patient, and then I would document my procedure.